All right, so I just picked up a new DON. All right, one of the questions that I first asked my DONs are, when was your survey? All right, because I like to start with the survey. Okay, I'm going to get a little bit of information about you, but then I'm automatically going to go to your survey because I want to tell you how hard you're about to work or not work in this facility. All right, this person, she didn't know when her last survey was. She didn't know how many citations. So today what I did was just did a review of the last survey, looked at the citations, and they did have a couple complaint visits. They had 3 complaint visits this year. All right, so this is where I talk about basic. All right, when you're getting into these positions, building basic, learning the basics, all right, doing the basic things that will get you to produce the outcomes that you want to produce. All right, now unfortunately the facility has a 1-star for staffing, so that means that's telling me that, okay, if you have 1-star for staffing, your staff challenge. So when you look at the big picture, realistically, how well do you expect the person that has a 1-star in staffing to produce? And they have a 1-star in quality measures and a 1-star in overall health survey. All right, so there's a lot of work that this DON is about to do. Can she do it? She can. Is it going to take a lot of work? It is. Will it happen overnight? Absolutely not. Okay, it's not. And that's not to discourage anyone. That's the realistic. That is to let you know that it doesn't happen overnight. And it's going to take, a couple years to get this facility to a level that is producing, positive outcomes. And it might not, if you get somebody that's really consistent and doing the work, and it might not. But again, it's not just the DON, it's the team. Okay, so what I've identified when I read over this survey is there's a lot of lack of processes. Okay, a lot of lack of processes. 2 things I'm going to tell you as a DON that you cannot afford to not do on a daily basis. One is round. Okay, people are always like, oh, you always talk about rounding. Yes, rounding provides you so much information that will allow you to produce the outcomes that you want to have a survey, a positive survey. Okay, why? You're looking at the environment, the smell, the noise, okay? You're looking at the interactions between the residents. You're looking at the interactions between the staff. You're looking at the presentation of your resident. What does your resident look like? Okay, is their hair combed? Do they have their glasses? Do they have their dentures? What does their cushion look like? What do their wheelchairs look like? What do their clothing look like? Okay, how are the staff on your team? What do they look like? Okay, are they dressed professionally? Do they have ID badges? All right, when you're rounding, all right, what does your exit looks like? What does your shower rooms look like? What does your med room looks like? Your pantries look like? This is why I say to round. Rounding is a non-negotiable, okay? It's non-negotiable. Rounding is going to tell you so much about your facility that is going to impact your survey tremendously. Those are 2 areas that you cannot fall short on. Rounding, and you cannot miss your morning clinical. Okay, morning clinical is essentially your survey. Okay, I don't care what anybody says. The things that goes on in that morning clinical is everything that they're going to look at in your survey. Okay, so they come in your building, they round, they listen, they smell, they hear, they observe, and then they're going to look at your records, your morning clinical. Those are non-negotiables. Okay, you have to do that every day. Okay, and then on the weekend, your supervisor reads that same information on the weekend to then follow up on anything else that needs to go on the weekend, such as somebody had a fall, or what was the intervention that was put in place. Let me make sure it's there. Okay, new admissions. Did the medications come when when that resident came in? All right. It is a 24/7 job. All right, but those 2 areas, I promise you, you cannot skip on morning clinical, and you cannot skip on your rounding. It provides you too much information that will allow you an opportunity to improve. Okay, so as I'm reading through, I'm looking like, okay, complaint visits. Right off the back, if I see you have complaint visits, it tells me, now, no, we can't please everybody, all right? So let me just say that there are going to be some residents that you're going to have to get that you're going to just say, you know what, unfortunately, I don't think there's a place for you. Let's try to find you another facility, because clearly we can't meet your needs, and we even ask for your input, and we still can't meet your needs either. So those are going to be some times when you just cannot, okay? But when I see a facility that has a lot of complaint visits, means they don't have a good grievance process, and they're not following a good grievance process, okay? So that process is being lacked, all right? So again, another opportunity for improvement. But when she's getting into this facility, it looks like everybody's going to have to be educated on policy and procedure, all right? She's going to work hard in this facility, all right? And I definitely think she's going to be able to do it. But I just want to put this out there. Some areas you can't skip on, okay? Morning clinical and rounding are 2 areas as a DON you just cannot afford to not do every day, okay? Consistency in doing the right things every day, following through on everything that you said that you needed to do that day to ensure that it is closed out. Okay, so when you're coming on as a client with me, that's why I'm going right to the survey, and baby, I'm going to read through that survey, and I'm going to be like, oh, okay, you know what? You got a good facility. Oh, this is great. You know, then I'm going to be like, oh, you know what? This is a challenge facility. And, you know, we talk about open positions, you know, when you come on board with me, because in order for you to be successful, you have to have people there in positions. Okay. You can't go in there being a DON and filling a staff educator, a wound nurse, infection prevention and control, doing scheduling. Come on. The math's not mathing. It's not going to make sense. So when you're getting into these positions, those are the things that we're talking about, okay? Because guess what? If you don't have those people to support you, then that's going to shift everything. And we need to start thinking about, you're going to basically be in survival mode, okay? You're going to be putting out fires every day, all right? So it's going to be like, okay, realistically, what is it that we need to do to ensure the safety for the residents, okay? Because that's what we're looking at. Okay, when you're going to a facility and everything is a 1-star across the board. Okay, we're in survival mode, and we need to know, what do we need to do to ensure the safety of our residents? Okay, take it back to Maslow hierarchy of needs. We're going to start there, all right? And then we're going to start taking baby steps to get to the next level. Why are so many open positions, and what are we going to do to fill them? Do we need to bring agency on board to even allow us to get our staffing numbers up? But more importantly, our quality measures, okay? Quality measures are important, but if you don't have staffing, how can you produce a quality measure? All right, and then how are you going to have a good survey? It's just, okay, I like to think realistically when we're looking at these surveys as well. So those are the things that we talk about when you're coming on board with me one-on-one, okay? Survey, you would talk about your support system. We're going to talk about the goals that you want as a leader. But one thing I focus heavily on, and I know I talked about this a little while ago, mindset. That mindset has to shift from floor nurse to leadership. All right, so we focus a lot on the mindset. What type of leader are you? Do you even know what type of leader you are? Okay, your approach, not only your approach, but your delivery. How do you deliver information? How do you validate that information? All right, so there's so much that goes into when you're coming on board with me as a DON that is in need of assistance, okay? But can it be done? Yes. Is a DON role for everybody? It absolutely is not. It is a lot of hard work, but I promise you, being a DON is one of the most impactful roles that you can have, okay? Because not only do you have the ability to change the lives of the residents, you have a major ability to impact the lives of your staff, okay? When they find out that you come in there and you are for them and you're going to support them, and you're listening to them and not just making changes, okay? You have the ability to really impact their lives. But I want to also remind you, when you go into a facility, and especially if it's a facility that has a lot of turnover and leadership, okay, it really decreases the morale in a facility, because you have to think, every time you turn around, you have another leadership person coming in and saying, hey, this is what we're going to do. We're going to make sure this, we're going to make sure that. And then they trust that with that person. Then that person leaves. Why? Because things, it's a difficult position if you don't have the support. Okay, so now they have another person. So be patient with them. Okay, assume they don't know and teach them everything that you want to know in order to achieve the outcomes that you want. All right, so follow for more tips.